and the founder of NovoPsych Psychometrics and NovoNote AI Scribe. And it's a real pleasure to have you with us. We've had over 2,000 people register for this webinar, psychologists, psychiatrists, counselors, social workers, and other mental health professionals joining us from Australia, the United States, South Africa, the UK, and many other places around the world. So welcome. That level of interest says something really important about our field. As mental health professionals, we are continually trying to learn and improve and to better understand ourselves and the people we work with. And that commitment to growth is one of the things that makes me really proud to be part of this community. I also want to take a moment to acknowledge the people at the center of our work. Our clients, including people experiencing significant distress, trauma, and mental illness. Tonight is ultimately about them, even though we're going to be talking a lot about ourselves. It is about refining our own capacity to notice and reflect and adjust and respond in ways that better serve the people who place their trust in us. And of course, in therapy, we are not just technicians applying interventions from a distance. It's a very real, very human thing where we are the instruments, and our assumptions, emotions, biases, all influence what happens in the treatment room. And tonight, we're very fortunate to be joined by two excellent speakers, Dr. Shane Rogers and psychologist Belinda Seymour-Wright. Before I introduce them properly, a few housekeeping matters. Tonight's webinar goes for 90 minutes, and there will be an interactive Q&A session at the end as well. And so please do put questions down in the chat box below. There's somewhere where you can submit questions to us, and I will put them to our presenters at the end. And also do join the discussion down below. In these live webinars, there's often very lively discussions. A few other matters: the recording will be sent out tomorrow. Slides are available on the website, and you can request a certificate of attendance as well by a form on that website. Before we really get into it, I'd like to just remind you and invite you to self-administer the Reflective Practice Questionnaire Extended. Dr. Shane Rogers, who's joining us tonight, is the author of this questionnaire. And one of the best ways to engage with this content tonight is for you to have self-administered it so that you can apply what you'll see on your screen to your personalized responses. This questionnaire is designed to be a scaffold for reflective practice. And if you scan that QR code with your phone and press administer now, or simply Google reflective practice questionnaire NovoPsych, you can take that questionnaire now. My name's Ben. I'm a clinical psychologist, and I work at NovoPsych, and it's NovoPsych's pleasure to be hosting this webinar tonight. We love putting on these webinars for the mental health community, and I know that about 76% of the people attending here already use NovoPsych or NovoNote AI Scribe in some capacity. For those of you that don't, NovoPsych is a world-leading psychometrics platform with over 150 high-quality psychometric assessments used in mental health care. And NovoNote is a AI scribe specifically for mental health clinicians. If you haven't used these yet, please do check them out. So, without further ado, I'd like to introduce our first presenter, Dr. Shane Rogers, who is a psychology academic at Edith Cowan University, whose research focuses on reflective practice, emotional well-being, and the development of brief psychological assessment tools for clinical and educational settings. His work explores how self-reflection and psychological well-being can better be understood, measured, and supported. And as I mentioned, he's the author or the co-author of the Reflective Practice Questionnaire, which he'll be talking a little bit about tonight. Alongside his research, Shane has strong interest in psychometrics, research methodology, and the application of psychological science within real-world settings. He teaches and coordinates units in cognition and research methods. Hey, Shane, welcome.
Hey, Ben.
And I'd also like to introduce our second speaker, Belinda Seymour-Wright, who's just down the hallway from me. I've had the pleasure of working closely with Belinda for a number of years. She's a educational and developmental psychologist and a supervisor with experience across the globe, including in South Africa, Australia, and New Zealand. As a supervisor, Belinda supports practitioners and organizations to implement evidence-based models with a focus on translating theory and research into practical, client-centered care. In both her clinical work and supervision, she is particularly interested in helping clinicians develop reflective practice as they navigate the complexities of effective, ethical, and sustainable work. She brings a grounded clinical perspective, highlighting how structured tools can be meaningfully integrated within flexible, reflective, and relationship-focused work. And I happen to know, because I know a lot of people that are supervised by Belinda, they're constantly giving me feedback about what a warm and safe and insightful environment she creates for reflective practice in the supervision. Hey, Belinda, welcome. So, welcome to everyone who's joining us a little bit late. Shane, I'm going to pass to you now, and you'll go for about half an hour, and then we'll go to Belinda, and then I'm going to do a bit of presenting at the end and do a bit of a discussion. So over to you, Shane.
Thanks for that, Ben. I'll just start sharing now. So, hi everyone. My name is Shane Rogers. I'm from Edith Cowan University. I have an interest in reflective practice, but I do other things as part of my research as well. And if there is anyone who has an interest in scoping me out a bit more, please check out my website at shanerogersresearch.com. But today I'm here to talk primarily on reflective practice, and specifically in my part of the talk, I'm going to be focusing on the Reflective Practice Questionnaire, which, as Ben mentioned, I'm a co-author of that questionnaire. So to kick things off, let's just think about what reflective practice is. And there are different perspectives out there, but I think it's pretty safe to say that in general, reflective practice is considered this sort of ongoing cycle of learning and growth in professional practice, that it's applicable to psychology, but also, virtually all professions really, or especially those that work with clients or patients or students, etc. And in terms of that ongoing cycle of learning and growth, it's about engaging in your practice and then finding moments to pause, whether that be in the moment or having a sit down with a coffee later on, and reflecting on your work in terms of thoughts and emotions and decisions, interpersonal processes, and essentially, everything really, or anything that you choose to focus on, with the hope that by engaging in that self-reflection, you can have insights that can lead to you then adjusting what you're doing, hopefully that can produce benefits for your future practice that you then engage in and then reflect more on, and the cycle continues to foster growth. So effective reflective practice is also generally considered to be where a practitioner strikes a balance between self-critical lens and also on one hand, and also being kind to yourself on the other, And when I say balance, what I mean is that because if you don't get the balance right, so that can not be as effective. So if you're too critical upon yourself, well, then that can lead to anxiety potentially and just a bit of uncomfortableness, where then you might avoid further looking to engage in reflection and adjust what you're doing on one hand. And then on the other hand, if you're being maybe too kind to yourself, then you might actually end up dismissing areas of your own practice that you may have identified that could potentially use some improvement. And then that dismissal might hold you back from growing. So it's a nice balancing act to do it effectively. And I know Belinda's going to talk in more depth on that in the second part of this webinar today, which I'm looking forward to hearing about. And why is reflective practice important? In psychology in particular, there is research that's been conducted with clinicians, and mostly qualitative research on clinician perspectives, where it's been found that generally clinicians, where they're engaging in reflective practice, do report that it does support their professional growth and self-awareness, that can help to improve responsiveness to clients in a couple of ways. Like first off, reflecting on your own practice, as per what I was talking about a moment ago, can help you just to improve your own practices and processes and your work, what you do. But also in psychology, a lot of what happens in psychotherapy is helping clients to become more self-reflective themselves, right? So if you can become better at engaging in reflective practice, well then, it makes sense that you should theoretically be better at also fostering that within your own clients. And importantly, it's also generally believed that engaging in reflective practice can potentially help practitioners navigate uncertainty and complexity that's inherent to therapeutic practice, and that because that uncertainty, as I'm going to touch on a little bit later, can potentially lead to self-doubt and potentially also lead to things like decreased job satisfaction and things. So helping, again, being reflective to engage in your own work can foster that ongoing satisfaction with what you're doing, that can again help you to grow, help you to be the best you can be in your work. And so therefore it's not surprising that reflective practice has really developed into being a core feature of training and supervision in psychological practice. So what I'm here for today to talk mostly about is the reflective practice questionnaire that's just recently been put up on Novopsych, which myself and other developers of the questionnaire are, as you're probably not surprised to hear, very chuffed, very happy about to have it up there, because it gets more exposure and more use for the instrument we've developed, which is fantastic. And considering that most of you are going to be having a go of using it and everything, I'm just going to briefly talk a little bit about the background of it, just to hopefully give a sense to you that this questionnaire isn't just a flash in the pan kind of measure. There was a lot of thought and work that went into it. And so I'll keep the story brief, which that things started back in around 2018, where I was approached by Lynn Prittis, who is now retired, but who's a very experienced clinical practitioner with a really strong interest in reflective practice. And I was approached by her because she really, the credit goes to her for really identifying a gap in the literature in terms of self-report measures for psychologists in this space. And we got together because, as she fondly referred to me as someone with the rats and stats expertise to come along with her and help. And it was a great collaboration experience for me. I got to learn a lot back then, and it's sort of still going for me too. It's opened up this whole world of reflective practice and research in this space, which I'm really grateful for, and it's been great. And so when we first got together and we first started thinking about developing the questionnaire, the first thing we did, which is pretty standard when you're wanting to develop other measures, we had a little look at, well, what's already out there, right? And at the time, interestingly, uh, most of the pre-existing questionnaires, they had been developed in education and medical sciences fields. And when looking at those pre-existing measures, something that occurred to us was, in terms of reflective practice, people from those disciplines, they had some of their own uh, angles of perspectives of looking at reflective practice. Where what I mean by that is, like, the education folk come at it from a bit more of a learning development kind of angle, and in medical sciences they tend to focus a bit more on decision making, and it meant that there was a bit of a gap there in terms of the client interaction, which is central to psychology. There wasn't really anything out there, and so yeah, that really reinforced to us that there was a need to develop a questionnaire more specifically coming from the angle of client relationships and working with clients. So after we'd confirmed that, we then really sat down and went back through the literature in this space and the background theorists. For example, the work of Donald Shon was really influential for us, amongst others. And then we sat down together and went through and collaborated, myself and Lynn, to come up with the original items on the original measure. And it was originally developed as this multi-dimensional measure for helping professions. So even though we were designing this for psychology, we also were really mindful that reflective practice is something that's not just relevant for psychology, but it's for a whole range of disciplines, and it's very prominent in education and medical sciences as well. So we wanted to design something that would be useful not just for psychology, but for other professions. And then once we had published that, we were very humbled and pleased that the interest that we got on the questionnaire. And interestingly, it was more from some of these other disciplines, from the education and medical sciences, that contacted us initially. And yeah, and so since 2018, there's been a bunch of validation and translation studies with the questionnaire in people from Japan, from Iran, Switzerland, Korea, amongst others. It's been nice to see. There's been researchers making use of the reflective practice questionnaire in training and intervention studies. So, like, standard sort of pre-post kind of methods where they're engaging in sort of reflective practice activities, and then wanting to assess if people's self-reporting of reflective practices changing from pre to post. And there's been several studies now with significant interesting findings on that. Also studies that are engaging in conducting comparisons across groups, like comparisons across different professions, also within professions. There's been studies finding links with the self-reported reflective practice from our questionnaire with empathy and critical thinking, which is intuitive, but it's also been nice just to see that coming out. Also importantly, in more recent studies, researchers have compared the RPQ and specifically the reflective practice subscale of the RPQ with measures of more general trait reflection, such as the very popular self-reflection and insight scale, which is a more like general life reflection. And it turns out that the reflective practice measure that we developed, it only correlates sort of weakly with these more trait-based measures, which we take as evidence to show how our measure of reflective practice, well, it's different from just your more general daily life reflection. It is more specific to being reflective on your practice. So, as I mentioned, we're really grateful and excited that the reflective practice questionnaire is now up on Novopsych, because it means it's hopefully going to, or already has gotten out there into the hands of practitioners, which is why we developed this in the first place. And what I'm going to do now is, because I know most of you have had a go at filling it out on Novopsych, I'm going to spend a little time talking a bit more in depth about what the questionnaire is and how you might go about interpreting the scores that you get from it. So, in a nutshell, what the questionnaire contains is 30 items that's split across 4 subscales. The reflective practice subscale, confidence subscale, uncertainty stress subscale, and work satisfaction subscale. So I'm just going to run through them one by one. And so for the reflective practice subscale, it's got 10 items. And how it was designed, I mentioned Sean a moment ago, the theorist, where they're famous for introducing this notion of reflection in action versus reflection on action, which is a pretty simple idea, really. It's just this distinction between being reflective more in the moment, hence reflection in action. Like, so an example item on the our RPQ is during interactions with clients, I recognize when my pre-existing beliefs are influencing the interaction. So the key word here is really like the during interaction. So it's when you're in the moment interacting with your clients, do you have that reflection happening? Importantly, it's not just reflection upon sort of your own thoughts and emotions, but also on those of the client. So that's why we have an item, during interactions with clients, I consider how their personal thoughts and feelings are influencing the interaction. So, recognizing that you've got it's a dialogue, it's a dance, and you've got 2 different people coming together with their own different baggage, so to speak, that you can reflect on. Also, so for reflective on action, it's more after the fact, after interacting with clients, thinking about, what happened, and both for yourself and for them. Then we, last but not least, last couple of items are on more general self-appraisal, which is kind of tying it up with a little bow. It's more about, as I was talking about before, the reflective practice, reflecting in such a way that you are appraising, your practices and looking to improve what you're doing. So here's on this slide, just to explain what's going on. With NovoPsych, the questionnaire had been up for a little while prior to this webinar, and this the numbers I'm presenting here are from a normative therapist sample of around 236, and so that's still ongoing, and these numbers might be slightly different in the future, but I can't imagine they'll be too much different because already it's pretty decent sample size for these sort of normative numbers. And so after some nice collaboration with the lovely people at NovoPsych, and shout out to Dr. Joseph Phillips, who I had some interaction with around this in terms of setting sort of some bands for interpretation. Based on that data, most of the therapists who've completed this thus far fall between a score of 4 to 5, which on the response scale for this questionnaire is in the sort of often to very often range. So for most therapists, as you might expect, they do tend to report being fairly engaging in a fair bit of reflective practice with the interactions with clients. And then, so I hope that for those listening, you can see how making use of this questionnaire for therapists could be particularly useful, especially in training contexts, and having people answer this and then reflect on how much you're reflecting. But even more specifically, even for more experienced practitioners, as per like what I've just run through in terms of the questions, you can, rather than just necessarily thinking about your overall score, you can dig a bit deeper, I think, where you could reflect on, well, based on how I responded to the particular items, reflecting on that. And what I mean by that is like, say you might be a bit lower for the reflection inaction sort of items, a bit lower on that more than the afterwards, because it can be a bit more cognitively demanding to reflect, during the moment than after. And you can kind of reflect on yourself and how you go about that and things like that, which I think might be useful for many people. So moving on, the reflective practice subscale is obviously the core subscale in the reflective practice questionnaire, but we do have several other subscales that when we developed the questionnaire, we felt was really important to include because reflective practice is interlinked with these other things that I'm going to be presenting on now, like such as confidence, like because part of the whole idea of engaging with reflective practice is for growth and learning and confidence building, right? So we have a subscale on that, and in this confidence subscale, there's items that are more geared towards self-appraisal of general confidence, such as reflecting on how you feel about how much experience you have or your level of practical skills and knowledge, and also items that are more geared towards communication in particular and how confident you are when communicating with clients. So someone who scores higher on these items is like someone, I guess, as my picture on my slide here, the analogies, you've got your compass, and you sort of, someone who's a bit higher tends to have more of a sense of where they're going, I guess, in their therapeutic practice. So here's the normative data that we have thus far for the confidence subscale, and so most therapists responded in a 3 to 4 kind of range, which is in the sometimes to often kind of range. And so how, again, I would encourage people to reflect on their score is to dig a bit deeper, because as per what I was showing with the items, it's about, you can think about, well, okay, let's say if you, on average, you're often on average, well then, but it's more, what I think is more interesting is, well, where, because, is it that, are you feeling that for your practical skills versus what about versus knowledge? How did you respond to that question? And things like that, as a way to help you better identify your own personal strengths and areas for improvement with your own practice. We also have a uncertainty / stress subscale, and why it's the / stress is because there are items that are more geared towards uncertainty itself. So they literally have uncertain in all the items. And then there are items that are a bit more geared towards the stress element. And so while the confidence scale is about, as I said before, it's like capturing this sense of to what extent is a person feeling like they've got that compass and a clear direction on one hand, and then this subscale is on the other hand, to what extent do therapists kind of feel that sometimes they might end up in the fog, so to speak, as an analogy, when they're engaged in their therapeutic practice, and why is that? If someone is reporting a bit more uncertainty, the idea is that then you can use your score to reflect more on, well, where is that uncertainty happening, in terms of, is it maybe particular, could it be more related to specific conditions, or diagnoses, or specific types of clients, specific topics, etc., etc., etc. A lot of things that you can reflect on. Same with stress. What is it about the stress that resonates most for yourself? Like, what aspects of the interaction is more for you to think about and engage in professional development on? It's some relatively recent research in Australia with psychologists answering the RPQ. They found a positive association with this uncertainty stress subscale with burnout in psychologists in Australia, which makes sense and helps to give a bit more validity, I think, to our measure, which is great. So the normative score on this subscale was around 2 to 3, which is in the rarely sometimes. So, most therapists do say that every now and again they will experience some uncertainty or a bit of stress, which, considering the nature of the work, I think makes perfect sense to me when you're dealing with highly complex and difficult cases. But I guess, as per what I was just talking about a moment ago, I think where people get the most use out of their responses on this questionnaire is to go a bit more deeper and think about the more specifics about their own practice and where uncertainty and stress might come from or be attached to. Last but not least, there's a little short subscale for work satisfaction, because this is linked to uncertainty and stress. So that same research I just mentioned from Australia found a negative association with this subscale and burnout. So, people who enjoy their work more less burnt out, which makes sense. But also importantly, so while these associations exist with these subscales of the RPQ and burnout, these same subscales of the RPQ also correlate with other subscales of the RPQ. So what I mean by that is the uncertainty stress correlates with the confidence. So while confidence isn't necessarily have a direct association with burnout, it may have a bit of an indirect association with burnout. And they talk a bit about that in that paper, but I don't really have time to dwell on that right now. But yeah, just my point here is that I do think with this questionnaire, these different elements are all kind of relevant within the realm of a person's professional practice and work life. So for the work satisfaction score, something that was quite, I guess, heartwarming to see was on average, the therapists were enjoying their work a fair bit. So the average range was within 4 to 5, which is very often similar to the reflective practice score. So we know that therapists are very reflective, but hey, and also they, in general, seem to be quite satisfied with their work. Obviously, there's a range around that, but for most people enjoying their work, which is nice to see. And I guess in terms of reflecting on this, using the questionnaire to just reflect on your own work and practice, you can still, again, think more specifically and deeply about your own work and what aspects of your work do you find bring you the most fulfillment and maybe what don't as much, and how might you moving forwards best arrange or organize your professional life to maximize the experience of your work to bring yourself the most fulfillment. Okay, so final thing I want to mention is that in the literature, generally, if you look up the academic literature and reflective practice, the theme is generally that reflective practice is great and amazing and everyone should be doing it and it's the best thing since sliced bread. But something that we were really mindful of when we developed the reflective practice questionnaire, hence the uncertainty stress scale that we included as part of it, was that we were mindful that while reflective practice in general is a very good thing and we're advocates of it, we also feel that it's important to acknowledge and talk about and be mindful of how reflection isn't necessarily always 100% a great thing, because if it's not done in a effective manner, it may contribute to things like excessive self-monitoring, unhealthy self-criticism, rumination, and stress, emotional exhaustion. And Belinda's going to talk a bit more about that in a moment. And so I guess my main point here is just that more reflection is not always necessarily better reflection. And that's why it's important to engage in training in psychology with supervision to facilitate practitioners learning how to reflect in an effective manner that will, help to facilitate lower chances of burnout and stress through the act of reflection itself. So thanks for listening to me. I'm now going to be handing over to Belinda Seymour-Wright, who's going to be talking to you more from a therapist perspective and wealth of experience in reflective practice. And here's some references that are going to be on the slides that are shared. So thank you very much.
Hi, everybody. It's lovely to be having this opportunity to talk about an area that I really enjoy working in. I'm going to talk a little later on about some of my experiences as a practitioner, but at the moment I'm working full-time as a supervisor and a clinician, and so I know that finding time for reflection in everyday practice can be challenging. Now, research shows us that effective practitioners, along with reflection, engage in more CPD than others. But we also know from research that simple input-only sort of conceptual knowledge type CPD is not effective in improving practice. So to try and tie this up and understand why that might be, good practitioners do more, it doesn't change practice on its own. I think the key is approaching CPD as reflective practice, and that's what I'm going to ask you to do in this webinar. So to help us do that, we're going to have a little sheet. Dr. Daphne Houston has a lovely website with some great resources, including this reflective practice sheet, but you don't have to click through for now because you really just need to capture these two questions, right? What did you find most interesting or helpful? And what are the implications for practice? So if you think about doing the RPQ, I want you to just take a moment and in a little circle, a little helium balloon, I want you to write down anything you found interesting or helpful and what the implications are for your practice. Nice and shorthand so that you can put it into practice. So conceptual knowledge, the ideas that you're going to get during this webinar, and also the insights that you're going to have as you're sitting here, they're kind of like helium balloons. They quite easily float away. And so with this reflective practice sheet, you've got a bunch of little circles or helium balloons where you're going to essentially tie down the important ideas. Don't try and make notes on the entire presentation. Just when something strikes you as, I want to action that, I want to do something about that, that's interesting, that has implications for my practice, pop it in a little balloon. Now we know helium balloons, once they're tied away, they can't fly off, but they can still go flat. And in order to not make them go flat, what we really need to do is we want to move from conceptual knowledge, thinking about, reflecting on practice, into procedural knowledge, actually doing it, getting kind of a muscle memory for it. And to do that, we need to select and implement some action steps. So that's the last part of your little reflective practice exercise. And what I suggest you do is capture your action steps towards the end of the webinar. Because obviously you can't action everything, but you want to have a few things that you're going to put into practice. I haven't covered everything in this short talk, it's impossible, but in my references, there's some that cover reflective practice and definitions and models a little bit more in depth. But if we just think about the example of this webinar and the little cycle that Shane has shared with us, you've all had experience as clinicians, as supervisors. What I want you to do during the webinar is pick an aspect of your work you want to think about and pause to consider it from the point of view of the information you're gaining during the webinar. You're going to have some insights, you're going to capture them in your helium balloons on your sheet, and then hopefully on the basis of that, you're going to adapt your approaches, skills, or perspective. You're going to put it into practice, you're going to have more experience, and then you're going to reflect on those. So there's basically a continuous improvement cycle. So essentially what we're trying to do is we're trying to move from reflection on practice to reflection in practice. Both are important. So we need to find and maximize our opportunities for reflection on practice. And so we're going to use all our CPD that way. And then we need to capture the key insights and implement them in practice. So that's the action steps. But of course, as we're doing that reflection between sessions, we're essentially improving our capacity to reflect within sessions. So as we think about this, I'm going to encourage you to think about us as clinicians as implied scientists, right? We're going to examine the evidence. This is research and our evidence-based models. On that basis, we conduct our own experiments. We decide what we're going to implement with our clients. We see if they work in our situation. And then we generate practice-based evidence, which then improves it. So we've got that continuous improvement cycle. But I like to think, and many of us do, of therapy as both a science and an art. We're both scientists and artists. Research has been clear for a long time that there are a number of common factors within what makes therapists effective, because we see similar outcomes across models. We also see that some therapists are more effective than others. So there might be common factors that both models are working on. And there's a certain level of skill that relates to the therapist that's not related to the model and not related to experience alone. More experience doesn't necessarily make you a better therapist, right? There's a key research finding that therapists' confidence in their model of practice has a bigger impact on outcome than the particular model that they're using. So we need to believe in what we're doing. We also know that in therapy, we need to have flexibility. We need to have the ability to improvise. If our intervention that we planned didn't work out, how do we change? How do we pivot on the spot? There are choice points and decisions in any model of working to allow us to individualize it for the client. So it's a little bit more like improvisational jazz than what it is like giving someone a tablet or building a bridge to specifications. And in fact, on that point, we know from research that the relationship between the clinician and the patient determines how compliant people are with their medication. So it's a lot more about how we do things than what we do. And relationship factors are really key. Clients' perceptions matter. One of something that correlates strongly with outcomes is how much clients felt their therapist liked them. So was that unconditional positive regard conveyed to the client? The alliance is critical to outcomes in research. So that's something we're going to be reflecting on. As Shane said, that relationship factor is really, really key to the work we do. And relationships have an element of art. So in the art of therapy, your reflective capacity can kind of be the player and your nervous system the instrument, as we play a little bit with this metaphor that's often used for therapy. And we know that nervous systems work best when they feel safe enough or regulated. But obviously a lot of things happen in therapy that are going to make our nervous system feel not so okay. And the ability to recognize and restore when that happens is a really, really important function of reflective practice. Basically, in session, you want to be recognizing when something's triggering you. You take some time in supervision between sessions to notice it. You've got more time to think. You're not as overwhelmed. You work it through. And the next time you hit up against something like that, you've already got an adaptive resolution part that you can draw on, right? So this restorative or tuning function of reflective practice is really important. We're kind of noticing when our instrument goes out of tune while we're playing and doing something about it. So working on strategies you can use to notice and regulate in session, and then of course making sure you take care of your instrument between sessions. Now tuning our instruments used to be a little bit like using these tuning forks, and now with platforms like Novopsych, we've got this fancy digital thing that does it all for us, where we can actually collect some really good information quite easily. And there are a number of measures that we can use on Novopsych that to check in with ourselves, and the RPQ is one of those. The professional self-doubt scale is really, really helpful because we all suffer from imposter syndrome. And there's a lovely webinar that Ben and Dr. Nathan Castle did on professional self-doubt and just monitoring where you are. Are you having so much self-doubt that you're immobilized? Or are you in that nice space where you are actually remaining curious and open to change? Sitting with some uncertainty, which is healthy. Or, have you become so complacent that you're just sort of dialing it in? And that's where too much experience doesn't necessarily result in good outcomes. The ProQual is also helpful for tracking on your own or with a supervisor how you're going on those burnout measures. The values questionnaire, are you able to live your values? And then general psychometric measures for checking in with yourself. Because we know that, for example, anxiety can really get in the way of our reflective capacity. So basically, like we ask our clients to do, we need to be noticing with compassion. Am I sitting, when I'm thinking about my work, am I sitting in rumination or activation? Is my thinking being dominated by criticism, blame, and fear? Did I do it right? Am I frozen or stuck? And when I'm noticing that, how can I move back into safety, into curiosity? How can I start asking those questions like, what can I learn? What did I do right? And really shifting ourselves into a space of humble, open confidence. That's, I think, where we're trying to go. So how are we going to do that? one of the ways we do it is taking time to know our instrument, right? And there's a lot of writing in the new competencies about the importance of reflection and especially reflexivity. That's the component of taking our reflective awareness and pointing it back at ourselves. So that's noticing what's happening in my nervous system in session, between session. It's also over time gaining an awareness of what are my resonances with clients, what's going to really trigger me off, what are my biases, my old stories that can get caught up. Also, as we reflect, we want to really make as many of our values as we can explicit to ourselves, because it's implicit values that can trip us up. So, if something's not sitting right for you in a session, just think about, what is there an unexamined value that's sitting there? And particularly important for this work, and being highlighted more and more as we hear lived experiences voices, are where are you located culturally and in terms of power and meaning frameworks in relation to your clients. And a really powerful framework for this part of the work is the Power of Threat Meaning Framework. And I've put some references. There's a lot of lovely free source material on that. So there's some references to that in the last few slides. But basically, I want to know where my instrument. I also want to know where my sheet music sits, in relation to systems of meaning. I want to know, where do I sit in relation to the orchestra? Where do I sit in relation to this person that I'm playing a duet with as I'm doing therapy? Now we know, as I said, that we're going to do reflection better when we're feeling safe. And safety happens and is learned in relationships. Therapy also happens and is learned in relationships. And reflections happens and is learned in relationships. So how reflection is happening for ourselves and in our supervision is really, really important. We know the research is pretty clear that reflective practice works better when we do it with others. I was always really, really struck when I sat with my supervisors how much insight they had and the perspectives that they had. And then I became a supervisor and I saw how different it is when you're not in the thick of the case. Even if you've sort of left the room, you're carrying all the emotional intensity of that case with you. And so having someone who's sitting outside can really make a difference. And oftentimes your supervisor doesn't even really need to give a perspective. Just having them there enables you to see things differently. Good reflective supervision should really allow you to feel safe enough to look at things that would be hard to look at on your own. And there's evidence from research that models of supervision where the way of being with, containing, the alliance that we're looking for with the client is modeled in the supervision relationship tends to have a positive impact on practice. So it's really, really worthwhile taking time to get supervision right. If you're feeling like this little girl after supervision, there's some work to be done. Shared models and ways of working, a good contract makes a really big difference because that creates safety in a shared system of meaning. But I think it's also really important that supervisors seek feedback and that supervisees give feedback. Let your supervisor know if it's not working. There's also, again, a little tool that you can use to measure. So basically through the supervisory process, and through internalizing a working model of your supervisor, you're improving your capacity to reflect in session. And you're also increasing your options, because the more you reflect on different cases, the more you've got different sort of ideas about working that you can pull down in a particular session. So I kind of think about it like, I've got a bunch of models of working, I pull them in, and I've got different ideas from them. I might have my helium balloons that I've had from some reflection on this case. They're all sitting up there. I'm being really present with my client, reflecting on all that, playing together and how's that going. And then I can pull those things down as I'm sitting in the session. And ultimately, based on your learning, you're going to be updating your working models. And I've just put some little tags there for how we might think of that reflective capacity as paralleling some of what we want to model in sessions. Another way that we help keep supervision and reflective practice on our own restorative is by noticing what's going well. We all know as psychologists, we have threat-biased nervous systems. We notice wrong things in a second, and we have to slow down for 12 seconds to notice good things. But we know that good teams have managers who give 5 positive inputs to every corrective one. So we want to be that kind of internal manager. And many of our best models, like if you think about the Gottman studies on the Masters of Relationship, looking at good relationships, and some work I'm going to talk about with young people with severe conduct disorder in the youth justice or the care and protection system, the learning came from looking at what worked for these population groups. A narrative of what's wrong is all very well, but it doesn't always tell you how to succeed. So you can implement this in a number of ways. You might have an action step to take time to notice 3 things that went well in a session, or 1 thing, or to do that at the end of the day, or to do that every supervision. Or you can let your supervisor know when something you planned worked out and notice together what you learned. But of course, we also want to have that openness to new learning. So this is again from Daphne Hewson. She says, I actively train my students when they make a mistake, they are to put their hands in the air and say, how fascinating. And she's taught her little grandson to do this. But of course, when he makes a mistake, like all of us, he's prone to guilt and shame. Now, as psychologists, we know that shame is not helpful. And then we're going to have to do some of that restoring, right? Which some can be done in supervision, some can also be done by your own therapy, which I believe is so helpful for knowing your instrument. And also the experience of sitting on the other side. But guilt is only helpful to the extent that it helps you make repairs and it helps you know how to do things better in the future. So just noticing that you're not getting overwhelmed by guilt. So thinking a bit about our opportunities for reflection, we've talked about using CPD activities, we've talked about supervision and how critical that is, and internalizing a helpful other. Then I think an area that's often underutilized is peer supervision, because we're learning with others, and because we don't have to pay a large fee for it, we can do it possibly more often. I think a key point, though, is just like supervision, we need to take some time to make sure that we're maintaining safety in that space. Obviously, as we grow our ability to reflect in session, all the session time essentially is becoming reflection time. I often think that a key function of note-taking in psychology is really reflection. And this is a little tricky because my AI note-taker makes much better notes than I've ever been able to make. However, I was finding that I wasn't getting the same kind of quality reflection that I did when I jotted down my own notes. And so it's playing with this, and me and some of my supervisees have thought about this quite a bit. And there are different ways that you can compromise. One chose to continue to make their own notes while keeping the AI notes in the background as a jog for memory. What I've chosen to do is, at the end where the next steps are put, just putting down a key reflection for myself, and also, what my plan is for the next session. And of course, you can also play around with Jan, which I think Ben is going to talk about a little bit later. I like to use Jan on the balance function because I think you learn a lot from what you do right, and also my nervous system is sensitive. But I found, when I come to Jan with a specific question, that's also really helpful because I'm not farming out all my reflection, I'm flexing my reflective muscle. I think formulation is a key opportunity for reflection, and a lot of what we actually do in sessions is, in supervision sessions, is formulation. But if you're feeling stuck with a client, or if your measures are showing you that you're stuck, just taking 5 to 10 minutes to do a simple formulation of 5 Ps or a model-based formulation, and really asking, what is the change that I'm trying to make here, and what are the levers for change that I can work on with my model, is really, really valuable. And then last, I'm going to talk about what I call the sewing machine phenomenon. So you might have been wondering about the sewing machine. So the inventor of the sewing machine, Ellis Howe, was really struggling to get it working, and he was trying and just feeling really stuck and overwhelmed. And he stepped away. He stopped working on it. just let it be. Took some time out, which we should do. And that very night, he had a dream in which people were stabbing him with spears with holes in the point. And he woke up and he went, Eureka. Actually, what I need to do is I need to move the threading hole from the blunt end where it is in traditional sewing to the point, and we got the modern sewing machine. So stepping away and allowing rest, and to let your unconscious mind, your right brain, whatever you want to call it, work on the problem, can often be in the service of reflection. So if you're feeling stuck, step away. So I want to talk now about two amazing reflective learning opportunities that I've had the privilege to have in my career. And the first was when I did my master's training in South Africa, and particularly my training in Kleinian play therapy, which is a psychodynamic kind of play therapy. And this is what it looked like. We would do the therapy on video, and then we'd watch the video, and in those days, by hand, painstakingly pausing and replaying, we'd transcribe the video. And then on the other side, we'd write, how does it relate to our theory? And what was I trying to do here? Did it work? What else could I do? What were my other options in the moment? Then we'd get together with our small learning group and our supervisor, and we'd go through parts of the video again and, learn from each other. And what our supervisor would be doing in those training sessions is modeling the kind of containment and curiosity that we were trying to bring to our little clients. And she also was teaching us micro skills. I think the thing I remember most from the training is ways of talking to children about difficult things. And I still teach some of those wordings to my supervisees today and think of my supervisor. So that was the one experience. The other was when I had the privilege of working for 9 years for Kia Puawai, which is a New Zealand not-for-profit dedicated to delivering the best available evidence-based models based on RCTs in partnership with Maori and Maori values for the most challenging young people in care and protection, or as an alternative, so kids with failed placements and things, or as an alternative to youth justice incarceration. So my consultant for that training is Rena in the front, holding up her kete or basket that they've been weaving on the marae, which is the traditional Maori meeting ground and meeting house, where they had a sort of immersive cultural learning experience. But what would happen in the training, once Rena had had a real experience of Maori culture, she'd be watching videos of my clinical meeting with my team and my meeting with the caregivers. And then I'd have watched it, I'd prepared a call guide, a lot like what I was doing in the play therapy, just a very different theory and model of way of working. And then she would model for me ways that I could talk to my caregivers, teach my caregivers and my clinicians that would help them implement the model and the key concepts of the model. And I could then model that for them. So there's a sort of learning from experience. So what were the common factors? Reflection on actual practice. It's kind of like trying to learn to play a sport by going to your coach with what you thought about the game without them ever having seen it. Also supervisors with experience in the work who'd also seen our actual work, sharing accumulated knowledge and experience. A clear shared understanding, theory or model of practice and rationale for change and healing. Common factors, skills, that reflective capacity being modeled and internalized, and micro skills being taught and practiced in the context of the work. We would learn something, implement it, the supervisor would see, and we'd follow up. And this was happening in a supportive learning community. So you might say to yourself, well, how am I going to do this in private practice? Well, I think the first thing you need is a commitment to improving, which you clearly already have by being here today. I think we really need to reflect on actual practice. That's scary, but really, really worthwhile. And we have a wealth in the transcripts that AI can now give us, where we can look at sections of our work or a session that went really badly and see what was actually going on. I mean, obviously video and audio are great and they give us so much more richness, and they're really helpful, especially when you're learning a new skill. I think the really utilized area is role play or play-based practice in peer supervision, where you have a client and a practitioner and an observer, and you take turns practicing micro skills, or practicing a difficult situation. We need to build or join learning communities with a shared model of working. And I guess in some ways, the NovaPsych webinar series is a shared community where there's a commitment to measurement. We need to practice together, and we need to capture our helium balloons and action them and reflect back on them so that we've got that feedback loop happening all the time. Another common factor was learning from those we are working with. This book by Patrick Casement I really remember very, very strongly. And it's on noticing really clearly what's happening between you and the client, and particularly how are they responding? How are your interventions landing for them? So that noticing is really important. And of course, we can really just ask. And there's a lovely webinar again on NovaPsych by Dr. Nathan Castle on what's called feedback-informed treatment. And I think there's another one coming up that touches on this as well. And it's really creating a climate of feedback within therapy. So you're collaborating with the client, really understanding what's happening in the lines and making adjustments. So who knew that measurement could improve timing and rhythm? But indeed it can, and that's what the metronome is all about, right? And so the same is true for us. And so there's a number of areas where bringing in some sort of measurement can be really effective. And these are sort of broad areas of research and work that are happening at the moment. So we've talked about reflective practice, which is what am I bringing to this work and what may I be missing, that sort of reflexive, deep thinking. And then there's measurement-based care, which is really what NovaPsych and other platforms like it have made so much easier, is we actually need to check in if the client's improving on the dimension that we're trying to work on in the therapy. It can help us identify lack of progress earlier, and it can reduce our over-reliance on intuition. Feedback-informed treatment looks at measures that actually assess how the client is experiencing the therapy, their sense of the alliance, their sense of progress. And this table, which you can sort of check in with along the areas that you're interested in, references some areas of study in that. And especially Scott Miller has a whole system and 4 brief measures you can use in session if those appeal to you, but there are also some measures you can use on NovaNote. And the last area that I think is very relevant for us and relevant for reflective practice is when I look at my actual work and I see there's something I'm not doing well, really getting clear on how it's going wrong and practicing it. In the both those training opportunities that I had, by really looking in depth at what I was doing and practicing how I could improve it, I understood my model of working so much better. Why am I doing what I'm doing in the moment? And I think about a recent learning experience with EMDR, and that practice in the moment and hearing from the trainer really, really sharpened my practice. So this is kind of like doing scales. You know, it's identifying an area you want to work on and really working hard on it. I've got a son who's a guitarist, and he'll sit and play, much to my chagrin, the same riff over and over and over again because he's refining it. So as I said, we want to measure, to check on our instruments, how am I doing, to measure and improve our alliance, and to assess whether what we are doing is working with our outcome measures. And these are really, to go back to the applied science idea, the results of our experiment. If we know what's working, we can learn from that. What made this go well? How can I replicate that next time? But we can also bring reflection to where things are stuck. These are just some measures from NovaNote in the different NovaPsych in the different areas. So in reflection on practice, we are essentially tuning our instrument and restoring our ability to keep playing, with the impact on clinician well-being and retention, consciously seeking to play better, both in the moment and over time. And one of the ways I think that we do that over time is, improving our sort of internal model of working, the ideas and concepts and understanding of person that we're drawing on. as we're sitting in the therapy session. So what I'm going to encourage you to do as we sort of move towards the end of the webinar is maybe just jot down 2 or 3 actions you'd like to take based on the reflections you've had in this session that might actually help you improve your practice.
Yeah, I particularly, like the emphasis on needing a climate of psychological safety in order for effective practice to happen. And of course, if we don't have a sense of self-compassion as practitioners, even when we're reflecting by ourselves, we can't do it effectively because we don't have psychological safety in ourselves. So I think, self-compassion comes before many of these things. It's sort of at the heart of lots of beneficial practices. So I want to talk a little bit now about a paradox in self-reflection, and then offer a sort of technological spin on reflective practice. One important weakness of reflective practice is, in fact, that the therapist is both the observer and the object of observation. And when we're observing ourselves, we can have blind spots, we can engage in confirmation bias, or indeed self-criticism when we're a harsher judge of ourselves than objective reality would suggest we should be. And we've also got a whole bunch of emotional residue, perhaps from the session that we just came out of, and all the emotions that are wrapped up in that. And of course, reflecting and noticing our emotions can be a really helpful practice in itself. But it can also bias our thinking. And indeed, sometimes the thing we would benefit from reflecting on the most is the thing we are least well equipped to reflect on. And that's why we do supervision. Reflective practice isn't just about thinking about it passively ourselves. It's about actively engaging it and having an experienced supervisor. And of course, those of us with a really good supervisor knows that it's incredibly high value, but it's constrained. It's constrained by the schedule, our schedule, the supervisor's schedule. We only have time to present, 1 or 2 big cases, and the details fade quickly, and so we have to curate what we talk about with our supervisor. I really like the analogy that Belinda gave in sporting, in the sporting world. It's like a sports person going up to the coach when the coach has never seen them play and just talking about the game on the field. Is that really going to make a sports person better at their craft? I think that the feedback loop is really limited there. And so while supervision is great, it also has limitations. It gives us that external perspective that we absolutely need. So what about AI as a reflective aid? I wonder what people think about that, and please, let me know in the comments below. I'm going to put this question to Shane and Belinda as well to get their feedback. So I wonder how many of you have used AI to get feedback on your session. In the way I think about it, AI is like a reflective bridge between the session and later, more structured supervision. The great thing about AI, and I'm going to demonstrate this to you, is that we can get immediate feedback. It's low cost. There's zero judgment. Belinda talked about needing a safe space. But I know for a fact that even with the least judgmental supervisors I've had, I still maybe censor myself for fear that they might raise their eyebrow or smile in that way that they're thinking something and not saying it. AI, we don't have to worry about that judgment. The other thing is AI can be grounded in the actual session transcript. And I'll show this to you. Just like Belinda was talking about, where her supervisor would actually look at a video of a session, which is incredibly valuable. AI can actually get, real-time input from the session as well. It's structured and it's repeatable. So I want to talk a little bit about, or show you, rather than telling you, I'm going to show you. So how one could use AI in self-reflection. So here I've logged into Novonote, and I've used Novonote's an AI scribe at its heart. It creates beautifully formatted clinical notes from the audio of a therapy session. And this, what I'm showing you now is a pretend client. It's not a real client. I don't have a client called Jessica Jones. And I'd just like to summarize her presentation. Jessica is a woman in her 30s with a prior disclosed diagnosis of borderline personality disorder, presenting with marked emotional dysregulation, interpersonal sensitivity, fear of abandonment, self-harm urges, sleep disturbances, and increased distress following a recent relationship breakdown. She entered therapy guarded, expressing strong mistrust of me and refusing consent for the GP contact, while also conveying a painful expectation that the therapist would reject, misunderstand, or pathologize her. And also saying things like, I've seen 5 psychologists before, all of them were rubbish, but I've read your profile on the internet and you're the one that's going to save me. But at the same time, you're probably not going to take me on because you're too busy and important. And so this is the sort of client that, I don't know about you, but the sort of client that makes me stress out. The sort of client I'd be bringing to a supervision immediately, thinking, oh my gosh, how am I going to navigate this? And I want to show you some instant feedback that Novonote could give you. If you press here on Jan, just ask Novonote, what you can do, you can ask the AI all sorts of questions about this client, from what did I miss and could clarify next session, create a formulation diagram map. But the one I'm particularly interested in is reflective practice, critique my session. How did the session go? What could I have done differently? And so when that mode is pressed, it asks you, what aspect of your work would you like to reflect on? And what tone would you like me to approach it in this reflection? And I think this tone is really important because, as we know, AI will do as we ask. If I get it to be affirming, it's going to tell me I'm great. If I get it to be critical, it's going to pick up on things I could have done better. But for this, I'm going to go balanced. I want it to tell me what I did well, what I didn't do so well. And I want it to focus on the relationship with the client. And what it's going to do, it's going to read the session transcript, and it's going to give me a balanced reflection of what I did well, some affirmations, and what I could do better. So it's saying strengths, relational attunement. You demonstrated genuine responsiveness to Jessica's process. When she named that you were trying too hard to get her to believe you, you paused and acknowledged it. This is difficult work, noticing your own overreach in real time. Transparency about countertransference. You were willing to name internal experiences. I felt anxious that you were going to leave therapy. And then scrolling down a bit, it's also got some areas for improvement. The rescue impulse. Your notes reveal that you felt a wish to rescue. This showed up in the statement. I think there is lots of pain underneath what you're saying, and I don't want to be another person that misses that. Jessica called this patronizing and a rehearsal. She was detecting your investment in being different from the other clinicians. This is worth monitoring, not because compassion is wrong, but because it can subtly shift the therapeutic focus. And so in doing this, Just Ask Novonote will give you feedback on how the therapy session went from the transcript of the session itself. And I can ask it things like, next session, what might I consider before I make a treatment plan? And it will think about it. It knows my therapeutic approach, and it will give me a series of suggestions, reflections, and questions that I could ask. It's suggesting, to clarify the diagnosis, considering a risk formulation, suggesting that I engage in or consider the readiness for change, and asking me, how will you structure the session to repair ruptures early? These are all the sorts of things that a good supervisor might also ask. I want to show you another example with another client, this time a very different client called Billy Bob. And this client is a bit different. I've been seeing this client, again, a made-up client, for 10 sessions. And we've sort of relaxed into this pattern of talking through things. Billy's a really great storyteller, but has OCD and anxiety. And I've sort of noticed that while the sessions are very entertaining for me, I feel like we're perhaps not getting anywhere. So if I get up, Just Ask Novo Note, and I say, all right, well, what should I approach on? And I'm going to this time be critical. And I'm going to ask it, how can I actually, or I'm going to say, critical. Critical. Am I colluding with avoidance? So I must warn you, if you're going to use this in critical mode and you've got a sensitive disposition, it can go hard. For me, I know that this is a fake case, and so I'm feeling psychologically safe enough to do it. I know that some clinicians have told me that they really enjoy critical mode. Other clinicians, like Belinda, has told me that she likes balanced mode because it focuses on strengths and weaknesses. And it says, based on your notes, yes, there are moments where collusion with avoidance appears to be occurring, though you've already identified this astutely. It says you joined Billy's humor when he was tearful, and the session drifted into a discussion of school absurdities rather than the core effect. And then it's also said, oh, well, sometimes you're not colluding. It hasn't been totally too harsh. And then it's pointed some risks going forward and invited me to reflect on that. So what I would invite you to do is, if you are using Novo Note AI Scribe to do your notes, to consider Just Ask Novo Note as a place between simply unstructured self-reflection and formal supervision. AI-assisted reflection, I think, is really powerful because it's immediate. You can do it straight after session. It's low cost, it's non-judgmental, and sometimes supportive. If you put it in an affirming mode, it'll definitely be affirming. And importantly, it's grounded in the session content. It's not us just curating and talking with our supervisor about what we want our supervisor to hear. It can actually see what you said, word for word, and give you real-time feedback on that. And it can help us uncover blind spots. And I think that my hope is that in this reflective practice cycle where we have an experience and then we reflect, that Just Ask Novo Note can help you reflect more deeply, help you see things that you wouldn't have seen, provide a perspective that you wouldn't have generated yourself, and support deeper self-awareness. And I think that if Just Ask Novo Note is operating and supporting you here, you'll get to insights more, be able to make more adjustments, and then hopefully future practice will be improved, and that cycle of reflective practice and improvement will continue. So I've got a bunch of questions that I want to put to Belinda and Shane. And Belinda and Shane, thank you so much for talking us through that tonight. And there's heaps of questions that have come through, and I can see that there are more coming through now. Let me pull some up. So, Josie asks, how to balance the appropriate level of self-criticism versus being overly critical with the self, especially for someone who has a lot of self-doubt in herself. Belinda, I know that you've worked with lots of supervisees with a lot of self-doubt. How do you think you can cut through that self-doubt when engaging with reflection?
So I think this might be counterintuitive, but one of the things that I tend to do for my supervisees who are struggling with self-doubt is actually get them to track their outcomes. Because in fact, we know that therapy is generally effective. And being able to see their outcomes gives them real information. And instead of getting stuck in your head, you can see, okay, these 3 clients, yes, their DAS is coming down. These 4 clients, oh, we're getting stuck. Then that's how, because we can figure out how to not be stuck. And that's what your supervisor is there to help you with, what Jan's there to help you with. So that's really, really helpful. Tracking how you're going on those measures. The noticing, get to know your own inner critic. And I think when I trained psychoanalytically, it was just assumed all therapists would go to therapy. And I do think I'm a big proponent for your own therapy. Get to know yourself, understand that inner critic. If you're having any more guilt than helps you to make a repair with the clients and learn to do it better in future, you're having too much guilt. So, it's trying to stay in that happy place. It's an art, it's balancing, right? It's something you're constantly having to correct. I think on the other end of the spectrum for myself as an older clinician, really important to notice that you're not getting complacent,
Yeah, that complacency, and we've done it for ages, and you sort of can rest on your laurels a bit. Shane, a question here saying, how does the stage of career impact people's level of self-reflection, early career versus late career?
Okay, thanks for that. First thing, I'll just my little 2 cents on that other one, just quickly. A practical suggestion is that I think sometimes people can fall into a trap of feeling the need to be perfect. I see this a lot in my role at the university of clinical psychs coming through because they're such high achievers. And so the practical suggestion is when you're engaging in reflective practice, it's what I think of as the stance of mentally, the stance that you're engaging in when you're being reflective. And what I mean by that is try to take the stance of, don't take a stance necessarily of, oh, I need to be correct, but instead take a stance of, well, oh, I just want to get better. And by taking that kind of stance, it's subtle, but I feel important and can make a difference. Because if you're just taking a stance of, well, I just want to be better, you're then allowing yourself to be more human and allowing yourself to not be perfect, and while still having a sort of a positive and growth mindset. So it's a sort of simple thing, but I think a nice little practical suggestion. Now, coming on to the other one, you mentioned in terms of the career stage. I mean, I think that's a tough one. Thanks, Ben, for a tough one. I do think that can vary depending on different people and their personality and their experiences. And I guess it's more around, I think, well, Belinda touched on this a bit in her talk, is that just because you've got more experience doesn't perfectly correlate with reflective expertise. So I guess, and I mean, in the research, there is a correlation, though, from research that's out there, but it's a very weak one, right?
Because my experience of it is that when I was training, I was constantly ruminating which is, rumination, reflective practice, sort of similar. And and then, these days really have to make an effort to engage in reflective practice actively, because I'm less likely to ruminate all the time now.
Yeah, so that's a nice point.
That's
It's
my
probably, I guess, that's lovely, because I think that probably is more. It's not necessarily about the extent of it, but perhaps over time and experience, a person's way that they engage in reflective practice is going to change. Yeah.
Belinda, I've got a question here for you. You said that reflections happen in a safe relationship, and you also mentioned that sometimes growth is about internalizing a supervisor's voice. Now, you've just asked Novo Note in reflective practice a lot. Have you internalized Jan's voice, or just asked Novo Note's voice?
Yeah, I think I certainly have an awareness of Jan, and I'm wondering and curious about what Jan's going to say. So that's increasing my curiosity in session, right? And often I'm having just like I would for a human supervisor, often as I'm having an interaction, I will think about things that Jan has brought up before. I mean, as you know, I have lots of reservations about AI, so I have to plant some trees because of using Jan so much. But I think AI can make mistakes, but a human supervisor can misunderstand you. So always sort of think about the feedback you get. Don't just swallow on whole. But you can also engage in a dialogue with Jan, which I found really, really helpful. It's deepened my thinking because I've asked questions, Jan has asked questions back. So, but definitely I have internalized it.
And a question here from Aileen says, how can therapists encourage self-compassion while at the same time striving for professional growth? It's interesting, isn't it? This tension that sometimes people bring up between striving and self-compassion. Belinda, do you think they're compatible?
Yes, I think you just have to think dialectically, right? If you feel safe enough to look at your mistakes, you're in a much better place to grow than you are when you are scared of looking at your mistakes, right? And one of the reasons you might be scared of looking at your mistakes is if you've got a very harsh internal critic or very high expectation, right? And you don't get into psychology without having high expectations of yourself. So doing some work on that, I think is really, really important. So we know that clients do well when they feel accepted for where they are, they're actually freed up to change. Similarly with us, when we're compassionate to how hard we're having it in a session and open to how we can do it better next time, that's where we're going to do really, really well.
Yeah, thank you for that. One last question. Belinda, you mentioned that therapist confidence in the intervention that they're using significantly predicts therapeutic outcomes. So if a psychologist really believes in their approach, it'll work better. But what I'm interested in is, and I suppose this is to both of you, have you seen, or do you think, how often do you see overconfidence getting in the way of effective reflective practice? And when is too much confidence or high confidence too much?
So I would say, just harking a little bit back to the previous question, defensiveness has gotten in the way of good practice more often for me than overconfidence. When I've got a supervisee that is defensive, either in relation to me or often internally defensive about looking at their own weakness, that often gets in the way of progress and learning. I think with overconfidence, I very seldom see that in new trainees. I think there's sort of a pre-selection for people who are pretty self-critical, and it's sometimes about not seeing or not being aware of, so lack of awareness sometimes for some new grads. And I think, speaking as an experienced clinician, a bit like you, Ben, this is literally your 1,000th or your 2,000th person who's telling you about their ideation, so it's complacency more than overconfidence.
Yeah, I definitely see that. Can understand that.
Yeah.
Shane, any final thoughts?
It's an interesting one. I don't think there's really much research on it, but it's a really interesting question. And I mean, one might expect, I'm just speculating here, but it's kind of perhaps in professional growth, regardless of its therapeutic practice, perhaps other things as well. People tend to go through a period of a bit of uncertainty early on. Then you start getting a bit of confidence, and it's in that more middle phase where overconfidence might start to creep in and then after a while, and you get a bit more experience, you then kind of have a light bulb moment eventually where maybe you make a mistake or something, and then you go, oh, hang on a second, I actually don't know. I haven't learned all there is yet. And then, yeah, later on in your career, you can start to, humbleness creeps back in again. It's an interesting sort of phenomenon that I've just observed in life in general, but yeah, I'm not aware of any specific research.
And the conscious incompetence and then moving through the stages of learning from conscious competence to unconscious competence. And so for me personally, the thing I love about reflective practice and different perspectives is it constantly brings me back to being conscious about what I'm doing well and what I'm not doing well, rather than just being on autopilot. So Shane, yes, Belinda?
Sorry, I'm putting up my hand. There was a really interesting piece of research where they found that new grads did better with very disturbed clients than experienced psychs, because new grads didn't know they were that bad and they weren't supposed to get better. So there is something to be said for confidence. I just thought I'd add that. And the other thing would be that the best guard against this is look at your actual outcomes, because that's going to help you be grounded.
Yeah. And I think looking at your actual outcomes and knowing that even the best therapists don't get more than 70% of their clients significantly improved. And it's not like we're going to help every single person. We're just here to do the very best that we can. So Belinda Seymour-Wright and Dr. Shane Rogers, thank you so much for this webinar tonight and the knowledge you bring. And to the audience, thank you for participating in tonight. I would guess that many of or most of the audience is more reflective than the average person, given you've spent an hour and a half tonight engaging in this webinar. So thank you for attending. We do have lots of recorded and upcoming webinars coming up. If you go to novopsych.com/training, we've got one on enhancing clinical reasoning using AI, which is our next one. So if you've enjoyed this one, do have a look at what trainings we have. Thank you, everyone, and good night. Bye.